Hi, you're listening to Every Scar Tells a Story with Cristina and Alejandra, the founders of Estes Beauty, the leading brand of luxury skincare for scars. When we started this brand, we were deeply moved by the stories people shared with us. Stories of vulnerability, resilience, healing, and strength.
These stories changed us, and we know they have the power to help others too. We created this podcast to turn those stories into something bigger, into something healing. Thanks for being here.
Hello, everyone, and welcome to Every Scar Tells a Story podcast with Cristina and Alejandra. We are thrilled today to be joined by Dr. Robert Schwarcz. He is a board-certified and nationally renowned plastic surgeon based in New York, specializing in cosmetic and reconstructive procedures of the face and eyes. He is widely respected for his artistry and expertise and has been consistently recognized in New York Magazine's Best Doctors list and named a Castle Connolly Top Doctor nationwide. We are particularly excited to have him here today because he has been part of the Estes story since the very beginning. Dr. Schwarcz was the first doctor we consulted before we started formulating our products, and he has been a tremendous source of knowledge, insight, and guidance every step of the way. Dr. Schwarcz, thank you for being here. We're so happy to have a conversation with you today.
Thanks for having me. I'm really excited to be here.
So, Dr. Schwartz, we just love you and we're huge fans of you. And I feel like Christina and I, have a good sense of who you are. But do you mind for our audience just telling us a little bit more beyond all the accolades and awards, what you do? Tell us a little bit about your practice. And if you don't mind, what the most fun part of it is for you. What gets you up in the morning?
I'm a cosmetic oculofacial plastic surgeon in private practice off Park Avenue in New York City. I trained at UCLA and then did a cosmetic training in Beverly Hills. I moved back to my home of New York City about 18 years ago. I was the head of oculoplastics at Albert Einstein for years before I went into private practice and jumped into full cosmetics. What gets me excited? Making people happy about the way they look, making them feel more confident about themselves.
I love that. And that is exactly why we connected, because that's what Estes is all about. So I have a question for you because, as we know, you're a plastic surgeon and you're helping people look their very best. But with that, with surgery, comes scars. When patients are coming to see you, is that part of the conversation from the very beginning, or do scars come up? How do scars come into the conversation when they come for their very first consult?
Well, every time you cut skin, there's going to be the process of scarring. Now, if a scar could be inconspicuous, people don't notice it, and I pride myself on that. And there are ways that you can minimize the risk of scarring through, not just suture technique, but lack of tension on a wound. That's usually the biggest reason that someone would scar. When a wound is under tension and being pulled apart, but it's only being held together by the stitch, it means that the work underneath it really wasn't enough. So you really need to support the tissue underneath it. If it starts to have tension lines and pulling, it will scar. So, we talk about how I try to minimize that. Scar placement is another thing. So, or incision placement is another thing. There's something on the face called Lanier's lines, which is natural lines and folds of the face. So if I smile, there are natural radial lines on the face. And if you can respect that and make incisions in those locations, the likelihood of scarring is minimized. But if I go tangential or perpendicular to those locations, the likelihood of scarring goes up dramatically. Sometimes, there's pieces of tissue missing. Could be a dog bite, could be skin cancer, and you'll have to geometric design. That design hopefully follows natural folding expression lines of the face to minimize all of that. So, yes, a scar or an incision maturation process is always in conversation. So, for instance, the most common surgery I do is blepharoplasty or eyelid surgery. So I will discuss the process of the incision. So first and foremost, the incision is made, let's say, hopefully in the crease of the eyelid so that it's well hidden. But then the first month, I tell the patients it will be red and ropey, meaning it feels, and it's supposed to be like that. Month 2, it's going to be thin and faded out a bit, but still will be pink, noticeable. Sure, you can cover it with makeup, but you should know that that's happening. By month 3 and after, it should be a faint little, barely noticeable white line. That's because I'm controlling exactly where it's placed and the amount of tension. But sometimes we're in predicaments where there's no control over it, trauma or need to open up something urgently for surgery or something, then all bets are off in that case.
Right. Well, this leads me to one of the questions that I wanted to ask you, because we've had this question come up a lot, is that we've had a lot of guests on the podcast and a lot of people in our community that have had to have medical related surgery. So breast cancer surgery or thyroid surgery, melanoma. And something that a lot of people don't know is that you can actually bring in a plastic surgeon to finish up that incision. Is that something that you do? And how does that process work if a patient would want to do something like that?
So I it's something that they should discuss with their primary surgeon first, because 2 schedules would need to be coordinated for the same time period, which is the most difficult time. I often will do that for skin cancer stuff, but I don't often do it like, I don't operate from the neck down. I don't do body surgery.
Right.
It's often done, let's say someone delivers a baby for a C-section. So if that incision is made, they can close it more meticulously. For instance, 20 years ago, when my daughter was born and my wife came home, I said, "Gosh, that's ugly. That doesn't look that good." She said, "Your business, leave it alone." And sure enough, it dehits, it split open, and I had to resew it in the bed. And that side looked better than the other side. So of course I pointed it out to the OBGYN, and she said, "You have a baby. Let's focus on what's important. Baby is healthy." And I was like, "Sure, but what about that?" Anyway, yeah, we didn't even think of doing that at the time. So yeah, you should just coordinate it ahead of time. It should be a discussion. And maybe the primary surgeon might say it's not necessary, but I would think they'd be relieved because that's one less thing they're responsible for.
So, number one, did you use any anesthesia on your wife when you were closing that area back?
We were not fighting at the time, and not. No, of course I use anesthesia. I numbed it. Even now, she's like not into like anything. Like my wife's an endocrinologist, and she's like, only like true medicine. And once a year, like all my patients are like, "Oh, she must be so lucky. She has all this at her disposal. Uses nothing." And once a year or every other year, she'll get her hospital ID redone, and she'll call me and go, "Oh my God, could you bring home Botox? I really starting to look old." I'm like, "Finally."
Well, tell your wife I love her as a diabetic. I have a lot of love for endocrinologists, so lots of love for her. I love what she does. Another question for you. So, if a plastic surgeon is coming in to finish off a medically necessary surgery, because you were talking about the layers. So, what are you doing as the plastic surgeon? Are you sewing up any of the layers, or is it just will you just talk us through that a little bit?
Yeah. So if you don't have full control of every layer of the wound, you have less likelihood of a great result. So, but you do have full control of those layers, meaning, you can close a wound in multiple layers, but it could still be under tension underneath it. More than likely, a C-section scar is not going to be under tension because it was just under tension, but that tension of that 8-pound baby or 7-pound baby just got released. So there's tension pushing on the wound. The OBGYN will definitely close the uterus part of it. And then the rest, layered closure, sometimes 2 or 3 layered closure, should happen from the plastic surgeon. They're not in a hurry because that's all they're there for. They should be able to close it meticulously.
Okay, so you've educated Christina and I so much on scars over the last, I don't even know how many years. at least since 2018. And something that I remember, and I actually quote you all the time. So if you listen to any of our podcasts, your name, Dr. Schwartz, comes up almost every single time because I did not like touching my scar when I first got it. I actually didn't want to touch it at all. I avoided it at all costs. And I wanted to develop a tool to apply the product. And I remember that you said you have to use your hands. And I was like, no, Dr. Schwartz, I can't touch it with my fingers. And you said to us, if you treat your scar like an alien, it's going to look like an alien. If you treat it like a part of your body, it's going to look like a part of your body. And you really were insistent on the fact that I had to touch my own scar with my fingers. And can you just explain that more to our audience? Because I can't defend the science of it at all. I thought it was like a Eastern Buddhist philosophy thing, but I think there's actual science behind it as well. Will you tell us about that a little?
I mean, you can accomplish the same thing with a gua sha device or whatever you want to do, but it's not the same. The tactile perception with your fingertips is so great. You can feel when something's tighter, something's stuck, something is fibrous or bumpy more than you can with a device as you're pulling it across the face or the body. The idea at the point of when a scar is going through the proliferation period, there's usually 4 phases of healing. So it's like hemostasis, like with the bleeding, inflammation, that's in the very beginning. Proliferation is until 6 weeks. And during that time period, I might intervene by injecting things like 5-FU, 5-fluorouracil, which is like a chemotherapeutic agent, which halts S phase of mitosis, which means the growth phase of the scar is halted in that period because the chemical, that chemotherapeutic chemical, the byproduct of it, the sort of like not the reason it was created, can halt S phase of mitosis. If you remember from your biology days, that's the growth cycle phase, and it can halt the growth of the scar. You can also give a steroid for inflammation if it's earlier on. And there's many other like modalities that you can do, but there's nothing better than mechanical breakdown of the scar. So as the scar becomes tense, you can soften it and break it down. And how do you know how much tension to apply on one side of the scar? It might feel differently than the other. Nothing is better than the proprioception that you get from your fingertips as you're touching it. It's absolutely the best feedback that you can get. So I know if it's like dense in one area, feels like a guitar string in one area and a rubber band next to it, I know I need to work it out more in that area. That's why your fingertips are more important than any tool that you can buy to use with it. I'm a big proponent of massaging it.
You described that so well. Can you actually go a little farther and explain for those who actually don't know much about scar massage and why you would even work the scar? Can you tell us how massaging and working the scar relieves that tension, what it does, and how that affects the way it looks and feels?
So the scar, if you were to surgically cut tissue and that's unscarred versus scarred, the scar tissue will have like a dense white sheet to it. As you're cutting through it, it's actually hard to cut through it as opposed to untouched tissue. This dense tissue has less vascularity, has less blood supply to it. That's why hairs don't grow through scars. It has less blood supply, but it also has I'm trying to put it into like
Layman's terms.
but like it has like a very firm sheet to it. And that causes adhesions, like stickiness. And if you can break that up, then you can soften it, and the thickness and intensity of that white band of scar is lessened. And the difference between a scarred aesthetically, other than the color, the difference between a scarred tissue and an unscarred tissue is the contour and the movement of it. So if one side of your face is scarred and the other is not, when you smile or move, the pliability, elasticity of the skin is intact on the non-scarred side, so it moves with freedom as your face or body moves, whereas the scarred side doesn't. It moves in block. It moves in one piece. If you can break
Mm,
it down mechanically with your fingers, then you'll have more pliability and movement. You're not going to gain much elasticity by doing that necessarily, but you can gain stretchability to the tissue, which is super important to make it look like a natural looking, untouched, let's say, tissue.
That's really helpful. Thank you for explaining. Years ago, another time we spoke to you, we had asked you about getting scars surgically removed. And I don't remember exactly what you said, but it was interesting because my understanding was like, you can't totally get rid of it. Would you explain a little bit about that, please?
Yeah, so you're trading one scar for another scar because you're always gonna have a scar. But you can trade a really unattractive, thick, dense scar for a thinner, more streamlined, nicer looking scar. You can change the direction of the scar like we just talked about. Like directionality is a really important thing when it comes to just movement or having it fall into what would be a wrinkle. So that all of that is important to change it to for scar revision. So scar revision is a possibility. That's a surgical scar revision. You can also start to scar revise with lasers topically, where it addresses the topical part of the skin. There's vascular lasers like a 532 or something that would end up addressing the redness of a scar, or if it's hyperpigmented, you can do a 1064 laser. All these different types of wavelengths can help with color, but they're not going to help with the thickness, the density of it, which is really what can be addressed with scar revision surgically.
Okay, so surgery helps like with texture, thickness, and then lasers would help with color.
Yes, lasers can help with thickness to a certain degree on the superficial side of the scar, but the denser part of the scar, the deeper part, lasers don't penetrate, and that's really what you're doing the scar revision for surgically. There are other things you can do, like radio frequency microneedling or even just microneedling. You can you can do repetitive microneedling, and then you can add a little stem cell activity like an exosome or a PRP or something to it to help stimulate cellular growth over there, and it can improve just topically. So let's say, instead of this more superficial layers will still be help with that. But the deeper layers or the direction of the scar can only be changed surgically by cutting and changing direction and moving it.
Can you, this is so fascinating. I'm asking you layman questions, so I apologize, but can you tell us a little bit more about the microneedling? Like, how does that actually work? Because in my mind, with the needles, you would just be making more scars. And so, how is it improving the scar?
You're not making more scars. You're creating more injury. And an injury of any kind will create stimulation of collagen growth, cellular growth. And technically, if you're putting in growth factors and stem cell factors into it, you have fresh channels that you've created into the skin so that they can seep in and have some sort of like growth activity for it. So stimulating it through trauma is what's going on.
Okay, so going back to the original question of scar revision surgery, because we talk to people with all sorts of scars. Which types of scars, or in which locations, do you think that surgery is most successful or has the best outcomes?
I mean, I'm partial to the face because that's what I operate on, and I think that because of the vascularity in the face, you tend to do better with it. The extremities, the arms, and the legs, especially below the knee, have poor blood supply, and they tend to scar worse, uh, and they tend to be less successful. Truncal, central scars tend to do better, and facial scars tend to do the best.
Okay, and what does vascularity mean?
Oh, I'm sorry, blood supply.
Okay. So the
Yeah.
face has better blood supply. And so the scar revision, the healing, all that will work better.
So blood supply is the name of the game for everything because blood carries oxygen, oxygen carries life to the tissue. I recommend patients go to like hyperbaric oxygen that increases blood supply to the area. There's this cool, fairly new product out of Japan called carboxylip, and that mixes two compounds together to allow for oxygenation of the tissue locally. All that is great, but on a very mature scar, it's not gonna do that much. You need fresh injury.
I was going to ask that question. So at what point is the scar so mature that really the only way to revise it would be surgically? Because if you start, for instance, going back to touching your scar and massaging it, if you start doing that as early as you can, do you have a better chance of having a better looking scar? And can you massage it after it's been technically a mature scar? Will you start to see a difference?
Yeah, 100% correct. The earlier you manipulate it, the better it will be. When I say time-wise, after 12 months. So after 12 months, it's really a fully mature scar. All those
Hmm.
other modalities are not gonna be as successful, but you can massage that scar for decades, and it will, it should help a bit.
And does massaging it help at all with the vascularity? Like, does it help bring blood supply?
No, it doesn't really help bring but it breaks down the denser tissue so that if there is a blood supply to it, it can get to it, but it doesn't create new.
Okay. Okay. But it can potentially open pathways for blood supply. That's cool. That's really cool. Whoa, I love all this.
From your perspective, what's the biggest missing piece of information for patients when they're getting a scar?
The earlier that you start being active towards it, the better. There's very few therapies that I'll say, like, "Don't do that."
Hmm.
I'm open to anything. Red light therapy, because there's some anti-inflammatory aspect to it. We mentioned hyperbaric oxygen, there's some aspect to that. Microneedling, anything like this, do it. Do everything you possibly can in the beginning. When I say early, I mean, soon as the surgeon said you can touch it, touch it. And that's usually within a week. Start working
Hmm.
on it immediately. The sooner you do, the greater chance you'll have at a better result.
That is a directive from a plastic surgeon. As soon as you can touch it, touch it.
Yeah.
That's something we have to all remember.
With clean hands. Sorry.
Yes, very important. Shameless plug, cleanse your scar, cleanse your hands before, use S's to cleanse your scar. Make sure everything's clean. We don't want any infections. So, after a patient has come to see you, and actually, could you walk us through a little bit about the life cycle of being a patient with you? They come in for their consultation, you talk about how the surgery is going to go and the scarring and whatnot. When did they schedule the procedure with you? Do they have to do anything prior? And then after the procedure, what do they do afterwards? What sort of post-op consultations are there?
So it depends on which procedure we're talking about. The most common
Okay.
procedures I do are eyelids, brow lifts. So that's a different scar. It's
Mm,
in the hairline. Eyelids are a different scar because it's the thinnest skin in the body and it heals very well. And then a facelift. And those are just strategically placed around the inside of the ear, around the corner, things like that. So I still talk about all of those. So my pre-op instructions are usually related to anti-bleeding things because something that's bleed around an incision, it puts tension on the wound, creating a greater chance of scarring. But I also like for nutrition to be optimized. So I like for most patients to be on a whole foods diet, and I like them to get most of it from plants. And I like there to be a high concentration of vitamin K in their diet for 2 weeks leading up to surgery. So that's like dandelion greens and all the different greens in there. It's part of my instruction sheet. So those things are very, very important to get the bloodstream full of great nutrients. I also don't want to take anything that can make them bleed. So even though curcumin sounds great and garlic sounds great,
mhm.
those things good for the heart and bad for post-surgical issues because it can make you bleed.
What can I ask? Why vitamin K?
It's a clotting factor so that it decreases bleeding. I have them do arnica, bromelain ahead of time, a week before, the day of, and then the week after.
Is that
Avoiding,
orally? You take
yeah,
arnica orally? Oh, wow, cool.
yeah. The topical one is a little less effective, but it doesn't hurt to
Mm-hmm.
use it. Yeah, oral
Okay.
bromelain. And these, like, bromelain, it comes from like the papaya. Love papaya. Papain is really good wound healing agent. Really, food is medicine in that sense, and it really helps
Mm-hmm.
heal. I have them stay away from inflammatory products, obviously like starchy things that are white, bread, pasta, rice, things like that. I have them for at least a week before to cleanse their diet from that. Nicotine, big no-no. There's
Mm-hmm.
nicotine receptors on blood vessels, and they cause the blood vessels to constrict, therefore less blood flow. Again, name of the game is blood flow. I'm a big proponent of sauna, and so I personally sauna 7 days a week. I think it's good for wound health, skin health, brain health. Don't sauna right after the surgery, but leading up to it.
The sweating, is that why it's good for you? Because you're sweating, or?
No, sweating is the end product of it. It's good for you because it releases heat shock proteins. So, like in your heart, it releases these proteins that help against inflammation. In your brain, it helps with synapses. It is like one of the healthiest things you can do.
Can you explain how it helps with wound healing?
It lowers inflammation and increases blood flow, but you're not doing it right after the surgery.
Right, it's prior.
I think red light therapy, if it's not the BS kind that you buy, from Amazon, if it's truly medical grade, so it's cost a few $1,000s. If it's truly medical grade red light therapy, you can do that leading up to the surgery for a week or so before.
Mm-hmm.
And I really think hyperbaric oxygen is great. Cold therapy as well before surgical. I mean, I do it on myself because it lowers inflammation,
Like
specifically
cold
in,
plunging?
yeah. And, there's protocols for it, like 50 degrees or less for 2 minutes, saunas,
Mm-hmm.
there's red sauna, there's heat-based sauna. The heat-based sauna is where most of the finished studies came from, and they're usually 20 minutes at about a 70 to 90 degrees Celsius. The infrared is fine, the heat from the inside out, you just have to double the amount of time you're in it to get the
Okay.
same. All of that is before surgery, but I'm also a big proponent of mental health. And so if
Mm-hmm.
you have the right mindset going in, positive thought, calm mind, you tend to do better with most things because your cortisol levels aren't through the roof and you're not walking around with all this like inflammation and angst. And so I talk about it. I don't know if everyone else does it, but I do talk about that. Uh,
This is why we love you.
Yes. Whole human. You're amazing.
That's the gist of it for pre-op. Post-op, I don't like too much manipulation to the wound. For
Mm-hmm.
instance, Aquaphor, because I don't know who's getting allergic to what I'm giving them. For the first week, if you get an allergy, that inflammation will tear the wound up. So I keep
Right.
things really simple. And then after the week, we can get into other scar therapy. Estes would be great after the week. I just
Mm-hmm.
worry allergies during the time when the wound is not fully granulated or closed in.
Yeah, we agree with you, by the way. We always say
Mm-hmm.
when it's a wound, it's a wound. It's not a scar yet. Don't put any estas on it. Don't put anything other than what your doctor tells you because it's not a scar. It is
Mm-hmm.
a wound. Leads to the inside of your body still.
If you're listening to this podcast, you may have a scar of your own or know somebody struggling with theirs. At Estes Beauty, we believe that every scar tells a story and that your healing deserves the very best care. That's why we created the first luxury skincare brand designed specifically for scars.
Our 3-step ritual, the morning massage cleanser, daily dose serum, and sleep salve overnight mask brightens, softens, and soothes scars while turning recovery into an act of self-care.
Your scars don't have to look or feel uncomfortable anymore. Try our products at estasbeauty.com. That's ESTAS beauty.com.
As we like to say, real healing leads to real results.
I do want to kind of go back to something you said about mental health and how people's mindset can affect how they go through surgery and how they heal. What are your thoughts around like things that people can do? Like, what do you tell your patients to do to lower their cortisol levels and be as calm as possible before a surgery? And I understand that the patients that are coming to you are electing to have most of their surgeries. So that's a certain mindset already, but still, you're nervous going into a surgery. How do you advise them?
Certain things you can eliminate, certain stressors you
Mhm.
can't eliminate. You can't get rid of your kids. Certain things you just can't eliminate. But if there are things work related or schedule related, they should be eliminated. So when a patient asks me what's the best time I should do my surgery, is it winter? Is it summer? No, it doesn't matter what the temperature is outside. It matters what's going on in your life. And if your life is hectic and, chaotic, don't do surgery then. If, your kids are in summer camp and, you're just relaxing for like a 2-week period, that's a great time to heal. Um, like reducing stressors in life is very, very important. That includes work related like emails and other things like that. On top of it, I mean, I meditate every day. If you can figure out a way to clear your mind, even simple mindfulness exercises are really good just to get a little bit of momentary clarity. Um, just kind of reset things, even if it just means laying an extra 5 minutes in bed before you get up and just thinking of something nice, just putting it simply. You don't have to like download an app or anything. Everybody has a different way of relaxing and resetting. So like I know for my wife, like her bath time at night, don't knock on the door. Leave it alone. And it could be your workout. Let's say you're working out. It could be if you're a runner. It could, whatever it is, clear your brain for a little bit.
Mm-hmm.
Getting a good night's sleep is good. Decreasing anxiety is so important. Sometimes I have a patient, I come in the morning of surgery to mark them, and I'm like, "Hey, good morning. Like, how are you?" And then they're like, "I'm so nervous. I'm so freaked out." And I was like too much of that, not good.
Mm-hmm.
You just try to lighten the mood. I'm like, guess what? I'm not nervous. Yeah. So I just try to keep them, you know, in a state of security.
Mm-hmm.
And there's something really powerful about positive thought and will change chemically what's going on in your body. And it really helps just to kind of reset. It's important. Life has stressors in it. I have a pretty like high stress job. So I do so many things to reset and re-stress literally every day, and it helps for longevity. When I was a fellow in my last year of training, my mentor said, was one-on-one with him,
Mm-hmm.
and he was like, "So, doc, what do you do for yourself?" And I was like, "I'm sorry, what do I do for myself? Like, I have a 9-year-old at home. I'm trying to pass the boards. You're barely paying me any money. I have to pay my bills. I'm covering call in the middle of the night.
Yeah.
Are you out of the touch with reality? Like, what are you talking about?" And he was like, "Yeah." He was like, "Do you know the amount of substance abuse and mental health issues that physicians that are in high stress, like surgical face?" And I was like, "I don't care. I'm fine." And he's like, "How about this? Today is Wednesday. You have Thursday, Friday, and Saturday and Sunday off. You don't have to do anything. Just think of something that you can do for yourself that could be for the next foreseeable future, for the next 10 years, a hobby for yourself or something you can
Mm-hmm.
do. But
Mm-hmm.
don't come back on Monday if you haven't at least found something. So,
Wow.
like, this guy is crazy. He's so out of touch with reality. How is he? What are you talking about? So I was driving on San Vicente in Los Angeles, and I got cut off, and I had road rage, and I started to like tailgate the guy. I'm screaming, and he went to the light, and I had the red light, and I stopped there, and I was like, "My God, I have to calm down. What the heck's going on?"
Mm-hmm. Mm-hmm.
And I look over and there's a building. I literally had to pull over and pull into a parking spot just to calm myself down. And I look over and there's this big sign and it said Hickson Gracie Brazilian Jiu Jitsu. And I was like, okay. So I got out of my car, I walked in and I was like, I'd like to sign up. And this was in 2006. And I was like, I want to sign up. And the guy's like, are you a fighter? And I'm like, no. He's like, are you training for the fight? I'm like, "No, I'm a doctor." And he was like, "Do you have experience fighting?" I'm like, "No, I don't have experience fighting." He goes, "All right, well, sign here, sign here, sign here. Go ahead, get in there." And, like, I they threw me in, like, immediately. We had the class, and then there was, like, sparring, and, like, I was fighting for my life to not be choked unconscious for 30 minutes, and I was like I had no thought in my head. I was like I couldn't think of anything. There was no stress
Yeah.
in my whatsoever. I knew
Survival.
what I was doing, and I was like, "Holy crap, this is amazing." And I still do it 4 times a week. So, it you have to find something to, like, create some kind of, like, passion. Now through that, obviously, I've had many injuries, but I also, at times of injury, had to create other things, and I started to, like, look at other pathways of mental health awareness and things like that because I see a lot of my colleagues that, eh, they aren't that great or they
Yeah.
compensate with other things and they're not grounded.
Mm-hmm.
That was my sort of funny, weird segue into it. But to translate that into patients, like you need to chill out for a couple of weeks here so that
Mm-hmm.
um, you can get healed. And some patients listen to it and some don't, and some genetically heal better than others, and you can't fight that.
Yeah, that was an incredible story. Thank you so much for sharing that. I'm going to repeat that story all the time because,
I went
especially
way off.
coming from a doctor, a surgeon.
Way off
No,
topic.
no, no. You have no idea how Esther's that whole off-topic story was. It is so perfect.
All right.
I want to repeat something that you said that I think is our next Dr. Robert Schwartz line that we're going to be repeating all the time. The power of positive thinking changes the chemistry in your body. And if you think positively, you will heal better. That is one of the most amazing things I've ever heard. And I truly believe this too, without a doubt. So, for anyone listening, just remember that thinking positively changes the chemistry in your body. Medical plastic surgeon just said that. It's not just Cristina Alejandra saying it. It is
You,
true.
I mean, I see it on patients. Like sometimes patients that have this like they're just so vibrant and they're like so excited and they're like, it could be whatever. They're coming in for Botox. They're like, this is going to be awesome. I can't wait. It's going to be like, me too. And it's like, they always come out great. They always look great. Sure, the things can happen. And then there are those people that come in, they're like, nothing's good enough. Everything sucks. And everything sucks. So there's something about that. Yeah, I also learned from patients through the years a lot about mindset. And I have a close friend that he was diagnosed with a late stage cancer like 8 years ago, and it keeps coming back. And he never is down. He's always positive. And I'm like, God, I want to be more like this guy. Everybody wants to be around him all the time. Nobody wants to be around the grouch that's like, woe's me, complaining all the time. And like I find myself sometimes complaining about stuff. My wife will correct me and she's like, okay, that's it's enough, And I
Mm-hmm.
realized like there's something so positive and attractive about being positive. And this this person is always that way. And I'm a little convinced that that's why he's still with us.
That's amazing. I would think that's definitely has something to do with it because when your mind is thinking positively, your body's not going to give up. It's all connected. You know that.
It starts like dopamine, serotonin, glutamate, all of these things aren't just make me happy in the brain. They translate into things in the body as well. And unfortunately, in allopathic medicine, which, regular medicine, Western medicine, we don't really learn it or we haven't in the past. It's sort of like, all right, tree hugger, move on.
Mm,
And
yeah.
surgeons definitely don't learn it. Surgeons like just keep cutting, keep cutting, keep cutting. But then as you mature in your field, you start to notice similarities and differences with people. And I just kind of like, I like that part of it. My daughter is graduating college and applying to be a clinical psychologist. So I noticed that she is like always so empathic and always so positive. And I'm like, God, everybody wants to be around this girl, like no matter what. So she plays rugby for her college team, and these girls are tough, like so tough. And so there's usually a paramedic on the side of the field. And I go to see they were playing Williams or whatever, and so I was there, and the paramedic wasn't there, and so she runs off the field, and she's like, "Hey, there's a girl that's hurt. Can you come on the field?" So as I come on the field, and clearly I heard this girl's ACL pop across the field. There, everybody heard it. We run over, and she's like, "Can we just tape it up? I have to get back out here." I'm like, "No, you're gonna have surgery in a week. You're not taping anything up." On the sidelines, she couldn't stand on the leg. There was no weight bearing. She was cheering, screaming for her team on the side more than anybody. I'm like, this is amazing. Like, this is what I want to see more of, instead of
Yeah.
woe all the time. And that's power positive thought, even though she's going to need her surgery. I'm sure she'll do well.
Like honestly, there's something about even if you are in a place of pain or a victim, but not letting yourself play the role of the victim, like somehow being the superhero, even if things are going wrong, it changes the course of things.
So this is called the sick role, right? So if you play the sick role, and this is like a thing known in medicine, you will be sicker. If you don't play the sick role, you won't. And it's not proven scientifically, but there's something to it. The concept is think in a positive light that you're going to be well and better, and you should be.
Dr. Schwartz, you're amazing. This is why we love you so much. And everything you're saying is so on brand with Estes, and Every Scar Tells a Story and everything that we believe. And I think part of the reason for that is because you were amongst our first advisors. So thank you for all of that. And before Christina's going to close this out, but before she does, I have to ask you a very superficial question and take advantage of your time. I want a little personal consult. What should I do about these wrinkles right here? I feel like a lot of people are worried. What are they called? Crow's feet?
Crow's feet. Can't we just do a little Botox and get it done with? And if it's just done selectively over there, it'll help and get rid of that. Don't do surgery, just put a little chemical in there and call it a day. But having to do with scars, if someone has a scar, let's say in a forehead or an area of high motion, I will Botox that area to stop movement so that that area can relax and not be pulling constantly while it's healing. So during the inflammatory phase, up until the end of the proliferation phase, up until the end of 6 weeks, I will deaden that area with Botox. So I'm glad you brought it up.
I've never heard of that before. Brilliant.
Little trick of the trade there.
Very brilliant.
Love that.
Okay, I have one more unrelated question, and then I swear to get back to scars. Do you believe in preventative Botox? So like the wrinkles will never form because you don't fold your skin that way? Is that a thing?
I'm 53 years old, and I've been doing Botox since I'm 38.
Will you smile for us? Because you look really good. Okay.
I believe in it. That's what it's for. Once the they're formed, once the collagen bonds have been broken, think of a credit card that's been bent too many times, and then I give it back to you and I say, put it back to its original state. You can't. So yes, Botox is used preventatively. I'm not talking this baby Botox for a 20-year-old. That's nonsense.
Yeah.
Once you start to see enough movement in an area where there's a faint line starting to be formed, that's the time to start it. And you don't need high dosages of it. You need small amounts selectively given so that it doesn't get there. Yeah.
Thank you for letting me take advantage of you during our podcast. This has been very beneficial for my personal face. Okay, Cristina, back to scars. Dr. Schwarcz was he's almost like a founding member, but he was one of the first people we met with. So his whole philosophy is so aligned with everything that we believe at Estes.
So I'm honored to have been part of that phase of it just because I'm so proud of what you guys accomplished. This is a really cool brand. It's not just what's in the bottle, it's everything about it. It's really cool. Great job.
Thank you so much. I feel like it's only fair that we give a shout out to your best friend since childhood and my cardiologist who put us all together, Dr. Humanya Gusadev. He saved my life, and I feel like we need to give Dr. Y a shout out for bringing this all to life.
My mom likes to point out he's a real doctor.
You're both real doctors.
You're very real as well. Dr. Schwarcz, so before we get off, I would love for you to tell us and our listeners how they can reach you, where they can reach you. You just opened a whole new clinic. So would you just tell us where you are, what you're doing, and how we get in touch with you?
But you can follow me on Instagram at Dr. Robert Schwartz, DrRobertSchwarcz. My office phone number, 212-396-4400. My website is www.naturalfacedr.com because I believe in keeping the face natural through all this process. My office is on 71st, and I have a satellite office in Rye, New York, and I just recently started a great venture. I opened up a cosmetic and wellness clinic in Shanghai, China, with a partner of mine in Minneapolis, and we have 8 US-based doctors working with us over there. So that's a very awesome venture I just started.
So cool. We're so excited to learn more about that. Yeah, congratulations. Thank you for joining us today. This has been an awesome conversation. It has gone in all the right directions. We're so grateful for everything that you've shared with us, grateful for your time, grateful for what you do, because I think there are very few out there like you. Thank you for being here.
So thrilled to be here, and thanks so much. You guys are amazing. Thank you.
Thanks.
Thank you for listening. If today's story moved you, hit subscribe and share it with someone who needs to hear it.
We'll be back next time. Until then, don't hide, heal.